Berkshire News and Politics.
Young People Special.
Today, we reveal the mental health crisis that our young people are facing in Berkshire. We speak to Dr. Katy Simpson from Berkshire CCG, who evidences the epidemic and points to solutions available for young people, but also more help that's needed. We speak to Wright from Emerge Advocacy about strategies that young people can use and the course she is running at All Saints Church, Dedworth and Windsor on the 17th of March 2022. And Reverend Paul Walker about other events he's running to help young people. But first, we speak to Slough Youth Parliament about their call to councillors Dhesi MP, Berkshire CCG and Sajid Javid for better resources for young people and now. Berkshire News and Politics, here to inform, equip and empower you. So we're joined today by Breanna Odoi, who goes to Ditton Park Academy, Year 13, Breanna Odoi from Westgate School, Year 13, Samir Akram from Herschel Grammar School, Year 12, and Nadine, Barret, who's a team leader at Slough Borough Council and with the Slough Youth Parliament. Guys, it's great to have you on again.
Thank you.
Thank you for having us.
Yeah, thank you.
So today you want to talk about providing mental health services and a consistent mental health provision for young people. It's something that's very important to Slough Youth Parliament.
Yes, it is. We found out that there are a lot of people, young people, who are facing mental health issues. And when discussing it in our SIP meetings, we all mutually agreed that it was something that we wanted to discuss and, tackle.
What sort of issues are young people facing?
Well, currently, obviously, we're all in school. So, we've got exams and, stuff like that just stressing us out. And I feel like because of lack of understanding, some people feel that, they don't need to go to a counsellor, or that maybe they can't go to a counsellor because they feel that how they're feeling isn't serious. And I think that alone is an issue in itself. I used to have little understanding about mental health. I didn't realise that anyone could have a mental health issue. And thanks to SYP and having these talks, I was able to gain my understanding and talk to my friends about it more. Another issue that I've also noticed is now that we're in global circumstances like the global pandemic, other political issues, it can have a toll on us. Even if it may not affect us directly, it still affects how we think and how we feel and our mental health as a whole.
How do you feel go through difficult problems?
I do feel anxious at times. Sometimes I kind of stress, and me feeling that way, I kind of just procrastinate and then I end up not doing anything about it. But then I'm thankful I have people around me that I can talk to, and they motivate me and they let me know, Breanna, everything's going to be okay. You can always push through it.
So you see that two of the key symptoms are that you feel anxious, your heart rate may rise, and you find it difficult to make decisions or to take action.
Yes, that's one thing I found common amongst my friends anyway when discussing about it. I feel like anxiety is one very common thing people feel, but they don't think it's just a normal thing that people feel. It's not something I have to talk about or I have to address. When really it's something you can talk about and receive help for.
Yeah, I agree with what Breanna was saying about how the main thing is just speaking about your mental health issues and just getting that release when you're talking to people. And a lot of people, you might not realize that they also are suffering from similar mental health issues, and it's just the fact that you guys can come together and just speak about it just benefits you so much more.
Samir, I believe you had a statistic from one of your nurses or from the World Health Organization, which talked about the number of people, and especially young people, who are actually experiencing difficulties, because obviously we've all got a level of mental health, high, low, but it's the difficulties when it becomes too much or starts affecting your behavior and your mood, that then it becomes a problem. How many people suffer from negative mental health issues?
It was actually 1 in 2 people suffer from negative mental health issues. And if you think about how significant of a number that is literally half of all the youth population have been struggling through a mental health issues that has negatively impacted them.
And how are people coping? Are they coping?
Well, of course, there's things in place at the moment to help people cope. But of course, overall, there's a lack of awareness within the community that people don't understand that mental health isn't something to be looked down upon, but it's something that we need to discuss and speak openly about.
In your schools, is this something that the young people are concerned about?
It is a big issue in quite a lot of schools across Slough. In my school particularly, there are kids, especially in exam years, that are suffering from a lot of mental health issues. Well, not only from exam stress, but home life as well. Within Herschel, we do have a lot of things in place, such as a peer mentor scheme and a lot of teachers who are willing to sit down and give up their lunch times to have discussions with the students.
What is it that you're calling for? What action do you see that needs to be taken?
So we're calling for basically the awareness of mental health within the community. As within Slough, we are a very diverse community and we have families from all sorts of regions across the world. And not a lot of people understand that mental health isn't something that we look down upon. It's something we must work towards and speak about. But also with this, we also aspire to have mental health essentially pods set up within the community. And this is also put on the national campaign where we want places around the UK where people can sit down and get through their mental health issues and just have that free space to speak without being condemned for their different thoughts.
I fully understand that. I think one of the biggest things I've experienced is that people need to know that they're not alone, that there's somebody out there who not only can help them, but who knows exactly what they're feeling. It doesn't matter how old you are, young or old. It doesn't matter if you're a judge or an MP or someone at school. It just doesn't matter. It affects everyone. So it's okay. It's okay to feel as you are.
And that
Go on,
figure
Samir.
of 1 in 2 people having negative mental health impact clearly shows that we are not alone and there are people out there with similar issues towards yourself.
Yeah, absolutely. Great point. So tell me more about these hubs. You said you want these hubs or pods. You wanted them to be created and to be readily available. How would they be funded or even resourced? Who would be available to help at these hubs?
Initially, we want to speak to the councillors and get funding from the government to set these up, as this is not only for just Slough. We want this to be a national campaign because, of course, it is similar to how we have the NHS. We need something to help people with their mental health because mental health and a lot of health issues do go hand in hand. So essentially, we just want that pod escape where we'll have workers there or just NHS employed workers there to sit down and discuss with the youth or older generation about their mental health issues and how they can help speak about it and just overall benefit from the experience.
And do you think that young people would be willing to go to these pods, or is there still more to do with making this an item or an issue without stigma, something that everyone can talk about?
We do believe there is more of a discussion to be had, as it is part of our campaign to raise awareness of mental health and get people to understand what it is specifically and how everybody does have their own mental health. It's just how some people are more negatively affected by their mental health than others.
The question you said, if you think that people would attend to it. Personally, I think some people would. Some people aren't always like, okay, we're talking to counselors in school or nurses in school or even like family, maybe because of like the stigma or the idea behind mental health. So, we believe that if there's a hub or something put in place where we can just walk in and like discuss our issues, that then they will be able to freely talk about how they're feeling, and then maybe they can find ways to resolve whatever it is that they're facing.
Okay, so you think it's important to have something that's anonymous and on neutral territory so that you can approach them with all confidence and in all security? Yes,
there's something about having that person not know who you are, kind of like makes us feel a bit at ease, because we don't want people judging us. I think that's another thing that young people have a mutual feeling about mental health. Some people don't like the idea that, because I'm feeling this way and I tell this person, they might view me differently, or they might think, they might dismiss how I'm feeling. So having those anonymous services, or even like if it's not anonymous but the person doesn't know you personally, it's nice to know that they're still willing to listen to me and give me advice and keep it in the highest confidence, of course. Yes, of course. Okay, Breanna,
Who would you like to send this message out to?
We would love the Mayor of Slough to address these issues, Mohammed Nazir. I think he can definitely make an impact, let people know that, oh, I am aware of these issues and I'd love for things to be put in place.
So Mohammed Nazir and perhaps even James Swindlehurst, the council leader?
Yes, even him as well.
I think we should speak to our local MP, so that would be Dhesi. And with Dhesi, this could even go up to Sajid Javid, who is our Minister of Health within the UK, because as we said, we do want this mental health scheme to be a nationwide project.
Absolutely. Final question is really, how can people contact you to find out more or to learn about what you're proposing?
They can contact us through the Slough Youth Parliament Instagram.
The young people are mainly on Slough Youth Parliament at Twitter and Instagram. And of course, you can follow the British Youth Council for the national campaign that's supporting this, along with Young Minds. So either of those websites will give you a bit more information on how things are going.
If you are a young person who is currently having any mental health issue, whether it is anxiety, stress, maybe even depression, we'd like you to know that there are services out there for you to contact. Even if you are unable to contact services or you don't feel confident to do so, you should contact your teachers, you should contact your friends, your family, and we love for you to know that you are not alone. I feel how you're feeling. I'm sure Nadine, even Wisdom has felt what you're feeling. Your feelings are valid, and no matter how hard life gets, there will always be help.
Right.
Yeah.
So everyone needs support from time to time. And if you are local in Berkshire, you can contact coof.com for online support. You can go to anyone at school to ask for your local services. Some of them have got some amazing getting help teams in Slough, Bracknell, Windsor and Maidenhead within your actual location that you can talk to face to face. And of course, there is number 22 counselling based in Windsor, but they do offer services across other areas as well. So check them out.
And you can find all of these details in the dialogue boxes down below. So don't suffer in silence. We're here to help. Breanna, Samir, Raha and Nadine, thank you very much for joining us on the show and telling us about what you're doing to champion the better health and better mental health for young people, not just in Slough, but across the UK. We look forward to hearing more about some of your other initiatives in the coming weeks. Thank you for joining us. Bye-bye.
All right, bye.
Thank you. Goodbye.
We've got Dr. Katy Simpson, who's the GP at Dedworth Medical Centre and also the clinical lead for mental health at Frimley CCG. Katy, you've listened to what Breanna and Samir and Raha have said. What are you seeing in practice in Berkshire?
So we're seeing a really significant increase in children presenting with mental health problems. And that's me as a clinician working in a local surgery as a clinical lead overviewing the sort of mental health services for the CCG. Particular problems for young people is a big increase in anxiety. We're seeing self-harm and we're seeing significant increases in low mood and depression. And, listening to the young Slough Youth Parliament talking about 1 in 2 of them felt that they had some problem with their mental well-being, and that chimes really resonated really well with something we were involved with last year called the Oxwell survey that extended to 30,000 children and young people across the southeast, and there were a number of different markers, sort of mental well-being, bullying, loneliness, sleep and exercise. But actually 49% of children surveyed, so that's children and young people surveyed between year 5 and year 13, 49% said that they had low mental well-being, 48% said they had moderate well-being, and only 3% said they had high well-being. So I think that sort of really does chime with what the young people from the Slough Youth Parliament were saying.
Now, you've mentioned a number of factors or triggers, markers, if you like, that young people can perhaps identify with, like low mood, self-harm. You've talked about poor sleep, poor exercise, anxiety, depression. If children or young people are listening or are facing these sorts of issues, where can they go to for help? What sort of help is available?
Well, something that we've really invested in is early intervention, and that's been a key priority for what's called the Local Transformation Plan for East Berkshire. One of the, I think some of your members of the Slough Youth Parliament are members of our Young Health Champions programme that we've commissioned, and they are really wellbeing ambassadors in school to give positive mental health messages, positive general health messages. They've also helped us to recommission our digital wellbeing service provider, so Kooth, which is an online digital provider for children and young people suffering from mental health problems. So our young health champions interviewed a number of different providers and picked Kooth, along with an interview panel. We've invested heavily in getting help teams to provide support, so it's therapists to provide support for children and young people with low mood and anxiety at the mild to moderate end of the spectrum. And then that's local money that we've used, and we've used national money to implement something called the mental health support teams, which are a team of CAMs, so children and adolescent mental health professionals, working with teachers to provide support in schools. And there's one across each of the 3 localities in East Berkshire, so that's one for Bracknell, one for All Borough of Windsor and Maidenhead, one for Slough, and then in September Slough gets its second mental health support team because we acknowledge the increased need in Slough. As well as that, we've also invested in a clinic called the Andy Clinic, which works out of Reading University and offers support for children with anxiety and depression. And we've also invested actually in the number 22 counselling service, which provides counselling in sort of Slough and the Royal Borough of Windsor and Maidenhead as well.
Where specifically can young people go to anonymously to get help today?
So Kooth would be the first port of call, and that's they do have chat counselling as well as moderated forums. So that is, a really good source of support. For people that don't really want the digital and want something more sort of face-to-face, then number 22 have actually increased their offer. So they're now doing a drop-in service for children and young people who want to know more about what number 22 offers, or they're on the waiting list and they feel they need a bit of urgent support. So actually number 22 now offer a short access phone call, which has proved really popular. I think they've had over sort of 50 children and young people call into that service since they launched that recently. In terms of accessing the getting help teams and the mental health support teams, and through the schools will have launched that in the assemblies at school, so that the children in those schools that have that service, they will know how to access through the schools. The getting help teams, access to that can either be by self-referral via sort of the Berkshire Healthcare CAMS website or via the GP, as well as obviously there's access to lots of national services. We know Childline have a really good listening service. And I was interested to hear what they mentioned about the wellbeing hubs. Now that's something that we have been looking at, and we've engaged with Frimley Youth Participation Group, which is part of the Frimley Hospital. They told us that they were more interested in a phone line, which obviously Slough Youth Parliament are talking about wellbeing hubs. We know we need more of an offer with sort of instant access, and it's something we're working on at the moment to look at whether it is a phone line, whether it's something like a crisis cafe or a drop-in cafe for children and young people when they want to talk about their mental health. So that is something that we're working through at the moment in terms of how to deliver alternatives to people having to turn up at A&E or contact their GP that's just a bit more easily accessible.
Okay. Now, before we move on to what you'd like to see happen in the future and what resourcing you'd like from government, I just want to explore the role of the GP. Can a young person go to a GP anonymously and their parents not be told? This would give certain young people some level of security and assurance. Is that something that's available to young people?
Absolutely, yes. Now, obviously, it's always done, the GP will make a risk assessment. So if a child and young person mentions that, they are feeling actively suicidal, then the GP will try and get permission from the parent, from the child to disclose that to the parent. And it's always a very difficult one. But yes, it's a confidential, safe space. There are certain times when the GP may feel, that there's too much risk involved. But they will discuss that with the child and young person. Unless there's significant risk disclosed, then absolutely it's a confidential space. We've trained GPs across the area in managing mental health problems. So we did that last year in our protected learning time in June. And then we've trained a bespoke number of GPs across the area. So in Slough, RBWM and Bracknell in managing children's mental health problems.
Now, some people will say, well, look, you know what, I'm not suicidal, I feel really bad, or I don't feel very good. It's not that serious. What would you say to young people who are thinking those thoughts? Now, I won't bother to call right now.
We know that early intervention is the best policy, but things generally don't get better on their own, that you need to do something about it, and talking to someone can be really therapeutic. So I think it's really important to share how you're feeling with a friend, with a family member, with a teacher, because that can be the start of, not feeling alone, realising that other people are having similar problems, and also getting the help that you need. So I think it's really, really important to get talking.
Katy, it's great to see that we're putting a lot of resources into early intervention. That seems to be going well. Are there any other areas that are going well? And what areas are not going so well? And how are we going to fix those areas and make sure that none of the children, young people who are caught in those areas actually stay in limbo, but actually get positive help?
Okay, thanks, Wisdom. So we have really invested heavily in our crisis and rapid response treatments. So we will be, by the end of the year, have a 24/7, 7-day-a-week CAMS rapid response service with a home treatment service as well. So that will prevent children having to go into hospital when they have a mental health crisis, and it's keeping them at home and in school. So we're really excited about that. That's going to be fully staffed by the end of the year with a big team of CAMS, children and adolescent mental health professionals, social workers and family support workers. In answer to your question about what's not going so well, the early intervention is going very well with these mild to moderate mental health presentations in children, and the sort of more severe end when children are in acute crisis and are very unwell indeed. But the middle, so where you've got sort of more moderate to severe, which is the traditional CAMS service, where you've got the specialist CAMS, where they've got their anxiety and depression pathways, their specialist pathways, eating disorder pathways. We acknowledge that the waits for those are rather longer than we would like, and that's something that the CAMS local transformation group is working on this year with our sort of stakeholders, and that includes talking to children and young people about how they want us to sort of do things differently.
Our Youth Parliament are looking to take this campaign, as well as with the UK Youth Parliament, to their local MPs, Dhesi, Adam Afriya, James Swindlehurst, to name but a few, as well as to Sajid Javid. What would you be calling for from these MPs and from government?
Well, I think it's great that we've got these mental health support teams, and it's absolutely fantastic that we've got 2 teams in Slough. But in Slough at the moment, there's 46 schools, and even with the second mental health support team, we're only covering 25 of those. So it would be great to have full coverage of these mental health support teams. They're a really brilliant, initiative. But really, we don't want half the population covered. We want the whole population covered. And we'd really like to see an expansion of that service to match the adult talking therapist service that is freely available to all. So that would be my big ask of the politicians.
Katy Simpson, thank you very much for that information and for actually placing young people at the heart of what you do. How can people contact you, or where can people go to find out more?
So we have a really good website called Frimley Healthier Together, which has all of this information, all of the current mental health support that's available. And so please do have a look on there. You can contact me through the Frimley CCG. I'm always happy to take any queries. But everything I've discussed and plenty more is on the Frimley Healthier Together website.
Great. Thank you very much, Dr. Simpson.
Thanks, Wisdom. Bye-bye.
Now, there's an event happening on the 17th of March at All Saints Church in Dedworth, which is really designed to help young people, and more importantly, their parents, to support young people who find themselves in difficulties. We're speaking now to Joy Wright, who's the CEO of Emerge Advocacy. Tell us about the event on the 17th of March.
Yep, so I suppose as a result of all of the time that we spend listening to young people when they're in crisis and when they're struggling with self-harm in particular, we've learned a lot about what's going on for them, and also how to help them. So what we do periodically is put on an event for parents and adults that are supporting young people that are struggling with this, or adults that would like to know more about how to be a really helpful, supportive adult to young people when they're going through something difficult. And so, yeah, it's just an hour and a half, couple of hours where we just share some of the insights that we've gleaned along the way. It's all really based on what we've heard and experienced in sitting in A&E with young people and listening to them. And so, yeah, we unpack about self-harm, what self-harm means for young people, understanding self-harm as a coping strategy. So not something that we just want to whip away from them, because how are they going to cope? and looking at actually what else could young people do? How can we help them to find less destructive ways of coping with what's going on in life, and how to maintain positive, healthy dynamics in our relationships with young people in the midst of all of this, because it's not easy for them, and it's not easy for their friends and family that are supporting them too.
Yeah, and you mentioned that it is a coping strategy, and that's very interesting, because obviously we heard from Breanna and Samir and Raha that their peers and their constituents are looking for ways to cope with the issues. Obviously, they need to also talk about the issues. What would you say are some of the key things that young people should remember or try and put in place to help them cope?
Yeah, that's a really good question, and something that we'll look at on the evening. Some of the things that we specifically talk about are very simple, actually. Things like, making sure that you've got a positive outlet, whatever that might be. So one of the things we talk about is doing something creative, and by that it doesn't have to be to create some kind of a masterpiece in art or music, but actually just anything that helps to get what's on the inside out. So that could be something as simple as taking a piece of paper and a Sharpie, scribbling all over that piece of paper, writing some words on it, and then tearing it up and throwing it in the bin. Because you're doing something that's giving some creative expression to what's going on inside. Other things that people do is maybe, go out into the garden with some ice cubes and just throw them at the floor, and that type of thing. Just finding something that helps to express what's going on, and it doesn't have to be in a way of talking, because not everybody finds it very easy to actually verbalize and talk about what's going on, because we don't always understand why we feel the way we do. And when we don't understand why, then that makes it very difficult. We can start to just feel really bad about ourselves and feel like, oh, I must just be like intrinsically broken or something, because I can't even give a reason. I don't even know why I feel this way. But actually, just to know that that's okay. You don't have to be able to explain it. It is what it is, and the important thing is that you find a way to express it that's not hurting you or hurting those around you. One of the other things that we talk a lot about is distraction, especially when people are struggling with things like self-harm, because the urge to self-harm kind of builds up, and it's like a wave, and it builds up and builds up, and you feel like it's always going to keep building, but actually, like a wave, it will peak, and you can kind of like ride the wave. And one of the things that we often recommend is an app called Calm Harm, which uses that very analogy of a wave, and it gives ideas of ways to distract yourself, to ride that wave of the anxiety and the urge to self-harm. And so, we just encourage people to think about, what other things can you do to distract yourself? How, like, do something that's fun, do something, whatever's going to work for you. And I think the thing is, everyone's different. So, I can say ideas, but the best thing to do is just to have a chat with a friend, and think about what's going to work for you.
Do I also understand you offer some other services through Wexham Park Hospital? Can you tell us more about that, please?
Yeah, absolutely. So we're just in the process of launching, and have recently launched a service in Wexham Park Hospital, where we're in A&E on Monday, Tuesday and Wednesday evenings from 7 p.m. till 11 p.m. And so we have members of our team who are there at that time to support young people who are coming in and who need to be in A&E because of self-harm or because of issues with their mental health or feeling suicidal. So we're really pleased to be able to start to offer this service in Wexham Park Hospital and in partnership with Frimley Health Trust. It's something that we're doing across Surrey and Kent already. And so, we're really pleased to have been able to extend the service to Wexham Park.
How can people find out more about the work you do and the resources that you have available?
So you can visit our website, which is emergeadvocacy.com. Our work generally, our kind of bread and butter work is in A&E with young people, and then supporting them after they've come out of A&E as well. And then, yeah, as I say, we occasionally put on these kind of training and insight events.
Okay, and of course the Insight event is on the 17th of March at All Saints Church in Dedworth, on Dedworth Road in Windsor, and it's from 7:30 to 9:30 p.m. and tickets are available on Eventbrite. But Paul Walker, Reverend Paul Walker, I should say, will be talking to us in just a moment about that. If people want to help you, how would they help you, or where can they go to help? What sort of resourcing or funding do you need?
Yeah, absolutely. Thank you for asking. We're really keen to really embed the project in Slough in the community, and to build relationships and to make links. And we've got some wonderful links, especially through the churches to begin with, and of course with the hospital. But yeah, if you're involved in the community, especially if you run activities or things that young people would like to get involved with, then we'd really love to hear from you about that, because a lot of what we do when we work with young people, especially through our follow-up support, is that we look to connect them with activities and things that are going to be, you know, a really good thing in their lives, and something that they can enjoy. Of course, we're a charity, and so we're always incredibly grateful for financial support and donations, and you can find out how to do that on our website as well.
Brilliant. Joy Wright, the CEO of Emerge Advocacy, thank you very much for joining us, and thank you very much for the work you do to empower and enable and equip our young people.
Thank you.
We're talking now to Paul Walker, Reverend Paul Walker, I should say, who is the vicar at All Saints Church in Dedworth, who are, of course, putting on the event on the 17th of March, which you just heard about, being run by Emerge Advocacy. Paul, welcome to the show.
Hello.
So
it's good to be with you.
Fantastic. Yeah. It's great to see that you're putting on this event. Why are you putting on this event? What's happening in your area?
Well, it's been a real privilege to get to know the community here since I began in my role last July. And in my conversations with different leaders in the area, and also with children themselves, both in church and in the schools, it's really clear that there's still a huge amount of need that's come as a result of COVID in the area.
So you seem to have a great heart for the community, and especially young people. Tell us about what you've been doing, what voices you've heard with the young people, and how are you going to put on events or tailor the ministry of the church in Dedworth to engage with people and help them?
So we seek really to be alongside people as a community together, and it's a real privilege to be joining in with a church that has been doing that historically for so long, and it's amazing to see the relationships that have been established over many years and to continue those in new ways. I think with regards to the various outlets that we have in community, it's been great to welcome people back into the building to worship together on Sundays, but also we try to be church out in the community in reaching out with different events. So we have youth events that we put on, and they're open to people that have no faith or any faith really. We're open to everybody, and we want to get alongside community in the deepest way we possibly can. And so specifically with the young people, outside of the stuff that we have with our youth groups on Sunday mornings and Sunday evenings, we also like to go into schools to be able to look at helping children to see how to live life in a way that makes the most of the life that we have. And we do that obviously from a Christian perspective, because as Christians that we believe that we have a hope for a future that comes from a relationship with Jesus. But obviously that is put out in a much wider context for people of any faith and of none, as we look at that hope for living alongside each other in community.
Can you tell me more about the event you've got coming up over the Easter period, which really does look at trying to, I understand, connect young people and help them with their spiritual side? Because of course there is the argument that we are not just human in the sense of matter, but we also have a supernatural and a spiritual side which contributes to our well-being. How are you dealing with that well-being aspect over the Easter period?
Well, of course, the events of Holy Week, where Jesus rode in on a donkey into Jerusalem to shouts of Hosanna, of praise, then going to the Last Supper, where he spent time with his disciples who were confused and sad at what they were being told, to the depths of sorrow when Jesus was crucified on Good Friday, to the resurrection, where we see that joy of the risen Lord. And so in many respects, those sorts of feelings reflect the feelings that we have today, both in joy and despair. And we're having that opportunity to bring the children from all 5 schools in Dedworth along to contribute initially, before they come, to a piece of art which they will do, which will be gathered together and all of the artworks put together to make an artwork, an installation, which looks at those 4 events of Holy Week, and allows the children in their own faiths or beliefs to explore what some of those more broad feelings that they have to these events specifically, but also to their own feelings with what's been happening over the last couple of years. And so they'll be focusing on the theme of Holy Week, and then after that they'll be responding to the specific questions that give them an opportunity to hand things over in one way, shape or form, but also to celebrate in the joys of hope that we see. And finding those opportunities to celebrate hope is so important, especially for young people who seem quite often to have the world on their shoulders.
What would be your message to young people listening, closing message at this point, given that they're reaching out and they're saying, we need help?
Yeah. Well, as a Christian minister and vicar for All Saints Dedworth, I'd like to say that God loves you, and we as God's church in Dedworth love you too, and we want to support you and walk with you in life, and journey with you on the ups and the downs through all of those life's challenges and joys going forwards into the future.
Right. Paul, you're running 2 events coming up shortly, the 17th of March, which is a parenting shop to help parents support their children at this difficult time. The event on the 26th of March, which is to help young people find solace and find some sort of level of well-being through tapping into their supernatural and spiritual side. How can people attend these events? Do we have to get tickets for the 17th and 24th, or do they just turn up on the day? And where do they get more information?
So you can get more information on all the events that we have at allsaintschurchdedworth.com. And with regards to the Emerge gathering, that will be ticketed. So if you go to the website, there's a link on the page that will take you to book on Eventbrite. You can also search it through Eventbrite as well. And then with regards to the expo, that will be an open exhibition on Saturday the 26th of March. The schools will be visiting throughout the week, but obviously for the public to come into the building to look at it will be that Saturday, where everybody is very welcome, and there'll be refreshments as well.
What would be your takeaway comments to young people listening or watching this? And can you give us the website again for people to get in touch and contact you?
I think my one takeaway would be that through my time here over the last few months, I've learned there are so many people here in community that would love to support you and help you. And also the website to go to for other information is allsaintschurchdedworth.com, and that has information about all our gatherings, including our 11 a.m. gathering for worship on Sunday morning for families.
Reverend Paul Walker, thank you very much for joining us. Bye-bye.